Welcome, everyone. Just going to give it a few moments for everyone to join our webinar, but thank you for joining us this morning. Good morning once again, and welcome to this installment of Church Health's COVID-19 response webinar series. Over the past year, Church Health and our faith community engagement partners across Memphis and Shelby County have hosted a number of webinars, everything from food justice in the midst of the pandemic to transitioning to online worship in the midst of this pandemic. Today, we are joined by Dr. J. Lawrence Turner and Dr. Altha Stewart for a conversation around vaccine equity in our community. Just so that you know, during this webinar, we will also be streaming live on Facebook. At the conclusion of this webinar, you will be able to find a recording on our YouTube page as well as our Facebook page for further review as well as sharing with your networks. During the course of the webinar, if you have questions, we ask that you use the Q&A feature found at the bottom of your screen. Please refrain from putting any questions in the chat, as we won't be able to keep a good record of those questions that are submitted. Please use the Q&A feature and we will feed them to our panelists and we'll address them as time allows. If you're on Facebook, put your questions in the comment section. You can continue to stay connected to us after this webinar by joining our Facebook group. The link will be in the slides, and we'll make sure to show this slide again at the end of our webinar, as well as subscribing to our e-news, where we'll have follow-up and resources that come out of this webinar. At this time, I would like to introduce Dr. Scott Morris, our founder and CEO at Church Health, to open us in prayer and introduce our panelists. Dr. Morris.
Great. Thank you, Joshua. So everybody, it was literally right at a year ago when Church Health first had our first webinar around the issues of COVID-19. Lots happened in a year. We've learned a tremendous amount. There's so many ways we need to take what we've learned and to apply it into our community. So 500,000 people have died in America. Who would have believed we would be talking about that a year ago, but it's true. What we know is the distribution of that 500,000 people is not equitable. COVID from day one, if you go back and look at things that we were saying a year ago, we were saying this was going to be a disease of the poor, disease of people of color, and who would have just ever believed it would have been so massive? What Church Health has also believed, though, and what the point of this webinar is about, is that the church and the faith community not only has a role, but needs to be out front and center, trying to protect the most vulnerable people in our community. We just can't stop. We have to move forward. Now, you may have heard me talk about this before, but Cotton Mather was actually the person, along with an African slave, who initiated the notion of inoculation in America. It was all about smallpox at that point. But that same concept of inoculation that came out of the church ultimately eliminated smallpox in the world. I think we have that same opportunity, and I don't know about the world, but we certainly have that opportunity here in Memphis. But we will not get there if we have not developed an equitable way in order for every person to be vaccinated, for us to deal with the enormous fear that is still out there, both of the disease and our past history around how we have, especially in science, used the African American community. But the point of this today is for us to lock arms, make sure we understand the science of this, and then address the issues around the fear, and then hope that our churches can lead the way to get our people vaccinated. So the webinar today is going to be led by two of my absolute favorite people, Dr. Jason Turner, the pastor of Mississippi Boulevard. He and I both went to Yale Divinity School. Sadly, we didn't know each other at the time because I was there like 30 years before him. But is on the board of Church Health as a disclaimer, but really has become one of the most powerful church leaders in Memphis. And he has been engaged with the pandemic since day one. The other person is Dr. Altha Stewart. In some ways, that I think Altha needs no introduction. She's a former president of the American Psychiatric Association. She got a big job at UT. I don't even know what her title is these days, but the big poobah at UT, I guess. But the two of them are going to lead us through this conversation, and there'll be plenty of opportunity for us to ask questions and get out on the table everything that we need to know so that we can move forward around the issue of vaccination of those who are most vulnerable. So before I let them take over, I'd like to offer a prayer for all of us. So can we pray? God, who knows no bounds, but who loves each of us in unique ways, may your blessing be for all of us to be healthy and that our lives be filled with joy. Help us as a community of faith live into matters of equity and justice so that no one is left to go it alone, not even one. We pray in your precious name. Amen. So Dr. Stewart and Dr. Turner, give it over to you.
Good morning. Thank you, Dr. Morris, for those wonderful words of introduction, and want to salute you for your superb leadership in engaging not only this as a health crisis, but also involving the faith community and bringing about answers and solutions to the challenges that we face during these times. As we begin our conversation on today, I'm so glad to have this conversation with Dr. Stewart, and I believe we'll be able to have a robust discussion in a short amount of time. We've come to a critical point in this crisis where vaccines are being distributed across the country that can help us to see a light at the end of the tunnel. And so, Dr. Stewart, I just want to begin this conversation just jumping right in with what you have called vaccine acceptance. That there are persons who are a bit hesitant in taking COVID-19 vaccines because they're so new and are a different type than the traditional vaccines. And so could you just speak to how messenger RNA vaccines work and why they're exciting for combating the virus?
Well, good morning, everyone. And let me first start by saying thank you for inviting me to be with you all today. It's certainly an honor to be in the presence of Church Health Center and Dr. Morris. And I want to thank you, Scott, for the prayer, because I think when we begin to see equity as a part of our community of faith, we really can accomplish many, many great things in terms of improving the health of our community, especially during the time of this pandemic. And thank you, Reverend Turner, for letting me share the platform with you today. The wonderful thing about science is that often we who are part of the science community can talk amongst ourselves in these big words that lose people. But the wonderful thing about science is that every now and then we get to put things into very simple, clear messages that everyone can understand. And so I thought I would start with a couple of graphics in answering that question. And the first one, Joshua, if you would, put up for me is part of the answer to your question about how the vaccine works. And this is from the CDC. We've all heard those initials over the last year of the pandemic, but the CDC director and his great team put together this graphic so that it will illustrate for people, and it's in the context of something that we all at least have heard about, even though I don't know what Snapchat actually is. I think people understand the concept in terms of social media, that the Snapchat process allows you, and think of this as your body receives an email through your immune system, and the immune system is just those cells in our bodies that fight off infection, the things that we want to get a lot of going, so that if something foreign enters our body, a bacteria or a virus, that we have some ammunition to fight it with. So that's our immune system. That's our army of agents internally that fight off all of these foreign objects like bacteria and virus. So when you think about the COVID vaccine, think of it like someone has sent an email, that's the virus, to your immune system that shows the virus looks like this. If you see this, this is what you need to do to kill it. And then we're done. We're out like a Snapchat message. It disappears. So within the body, by taking the vaccine, you're instructing your body, if you see this, kill it. It doesn't contain any live virus. You're not going to get COVID if you accept the vaccine. And the method that they use was actually quite ingenious and has been, for the sake of people who believe this was too quick, these kinds of what we call mRNA. That's a fancy word for some genetic things in our body that instruct our body on what to do and how to do it. It's what decides, everything from the color of your eyes to whether you can digest milk or you're lactose intolerant. There is a mechanism in our body for all of those things. It's the body, from a faith standpoint, is the best crafted machine in God's creation. We can do a lot of things, but the mRNA piece of this has to do with the messenger. The M stands for messenger, and it's the mechanism that our body uses to give those instructions on what to do when you see something that doesn't belong and what to do with it. There's another graphic, Joshua, that I'd like to show also, to get a little more in depth in terms of, because it's an mRNA virus and because we've been studying these kinds of messenger methods for a long time, we were pretty far down the road to understanding how to use them when the COVID-19 virus appeared. So while it may seem like it happened quickly, there are people who have given their life's work, one of whom I think should be elevated, especially during Black History Month, because it's a young Black researcher. Her name is Dr. Kizzmekia Corbett. And if you look her up and see that face and that smile, this could be your daughter, your niece, your granddaughter, your sister. And this is a young woman who has really made her life's work working on vaccines. Now, the appearance of COVID triggered some things that were already in the pipeline, because while COVID-19 was new to us, that group of viruses has been seen before. And so the work was already underway. And I regret, like everybody, that someone decided to name it warp speed. It led people to believe that it happened like that, and that's really not accurate. And I want to make sure to dispel that misinformation as we go forward. And so this graphic tells you how the vaccine works. The fact that they were designed to be, with the exception of this last one that was just approved, they were designed to be 2 shots over a period of time that did that Snapchat message, I see you, I kill you, I'm done, to give your immune system the right trigger to do that. And then we're not sure yet. The science is not clear yet on whether we'll get booster shots or whether there will have to be like a flu vaccine, the annual shot, just to keep our immune systems active. But the vaccine does communicate the vaccine tells our body's immune system, this is what you need to attack. And that messenger RNA is what provides the instructions as to what the immune system should do. That's a long-winded answer, but I wanted to stay away from a lot of the science because I know that can bog people down. And all of these are available, through the at the end of the meeting. We'll make sure all of these graphics are available because these are handy for people to have to use to explain to other people who may not have good information about what's going on.
And that was a necessary explanation, because I think a lot of the misinformation that is out there, continues to perpetuate things that haven't been verified, haven't been studied. And so I thank you for that answer. And I just want to go back to Dr. Corbett's role in developing this vaccine. Mississippi Boulevard is an African-American congregation primarily. And much of the challenge with vaccine acceptance is with dealing with the history that goes back to that Tuskegee experiment. And what does her role in the creation of this vaccine mean to our communities, that in helping us become more comfortable with the vaccine?
Well, first, let me say that while Tuskegee is what stands out, the Tuskegee syphilis experiment is what stands out in the minds of many people. There actually are events that happened from the beginning of time when the first enslaved Africans arrived, in terms of horrible experiments from medicine on the bodies of these individuals. There are people who made their name in medicine because of the experiments they conducted regularly without anesthesia, without any understanding of the humanity of the individuals they were experimenting on, that have laid the foundation for how a Tuskegee could even happen. So I want to make sure that people understand Tuskegee may be that benchmark that people recognize because it happened in our time, but we can go back 400 years to the same or similar kinds of experiments. As medicine began to learn, the people that it learned on tended to be Black and brown people and Native Americans as well. So that's one piece of it. But Dr. Corbett's work and her position, if you will, in the hierarchy of what we are now dealing with, I would answer in this way. I heard her do a presentation and she was asked, why should people believe that this is any different from Tuskegee? And I'll paraphrase her response, but I was struck and compelled to sort of integrate it into my being, is that happened, and we all regret, those of us in science regret that it happened, and we understand how it laid the foundation for the mistrust that we are currently experiencing with healthcare and with science. But what we have to recognize now is that if we are tied inextricably to what happened in the past, we miss the opportunity to make a difference in the future. And she related it to the population in the United States of African Americans is around 13% and has hovered there. The population, the number of, the rate of individuals who participated in the vaccine trials, at least for Pfizer, the data that we've seen says that was around 10%. So we are closer in our participation in something that disproportionately impacts us than we have ever been in medicine, because we were able to engage people who were Black and brown in participating, so that we could identify any unique problems that might arise in those populations. And now, as you heard, even in the opening prayer, there is inequity in how people are receiving the vaccine. There is inequity in what people are learning that is factual about the vaccine. So we've got to bridge that former inequity with the understanding and knowledge that we have now that can make a difference going forward.
So we've got to talk about the whole misinformation challenge that we're up against. I've often said that a lie will take a trip around the world before the truth even gets its shoes on. And so, in this time, as vaccines are becoming available, the misinformation persists. And so I've made a point as a faith leader to say to our congregation, hey, I'm not a physician. And our church does not give, medical advice. Talk to your local physician. I say that at any time. At the same time, I found it part of my responsibility as a faith leader to make sure that I present credible resources to my church, so to help them make the decision that's best for them. And so I would love to hear from you. What do you think are some of the best strategies that leaders in the community, in the faith community particularly, can use to address misinformation that's being passed around?
Well, a couple of things come to mind, Reverend. The video that was done by the group of faith leaders early on in the pandemic, I think Dr. Morris actually initiated that work. I sent that to everybody I knew and said, "This is what our faith community is doing," and the visual of ministers who are trusted, if not by everyone, by their congregations, who then spread the word to their families and their friends of masking, social distancing, hand washing. That was a powerful message because that was grounded in fact. Those kinds of things, we're contemplating other ways to message this, to give the factual information in a way that people can, like the graphics that I use, that people can actually understand and hear and see, so that they can buy into that, and instead of whatever is floating around on Facebook today. The fact that people have to be educated. We can't just do a one and done when it comes to misinformation. We have got to be out there every day with everyone that we see, everyone that we talk to, stepping forward and saying, "I know you believe that, but the actual reality is." And to do that, people have got to get educated. Things like these webinars are fantastic in terms of educating large groups of people with good information that they can then take, because they are trusted by other people, and say, "I know that's going around on Facebook, or I saw that whole video on YouTube, but the reality is this was not done in a secret laboratory in some black site, where they hold all these deadly viruses. It was actually done in the light of day." And Dr. Corbett, for example, works in the area where Dr. Fauci, the person that we have come to trust over the last year about facts and science about this virus, she actually works in a lab in his institution. And there are other key people who are part of the solution that we need to start listening to, and not just everything that circulates on the internet.
As the distribution goes forth, I was thinking about some of these, shock headlines that come out that say somebody died 6 hours after taking the vaccine, and that gets more, distribution. It starts trending. When I have, even in these first few phases of the distribution, I think we're at now 65 and over, and educators. There are people in my family, people in my congregation who have received first and second doses of the vaccine. But that doesn't get out. I would just, want to hear, from your perspective, how do we respond to those headlines that start trending on social media, but denies the fact that millions of people have taken the vaccine and have not died in 6 hours? How do we help to get beyond those headlines?
Well, that is a great question, Reverend Turner. And my answer to that has become, as you said at the beginning, I have changed my language because words matter. I have changed my language to vaccine acceptance when it's available. From vaccine hesitancy because I'm worried about it. Just that shift in the mindset and the wording of the message is making a difference, I think. Like you, I've had older family members who initially thought, "No, I'm not sure, it happened too fast." And once you have that conversation about, actually, this has been underway for over a decade. We've got people working nonstop to keep up with everything that's going on and to produce the science to support what they're saying. This is not just some anecdote, or Dr. Stewart said, or she thinks, and she had a dream last night. This is actual science. The other part of that, though, I think that is worth having just a bit of a conversation about, has to do with access. And around the country, we are hearing that the usual places where these things start are these mass events where lots of people can come. Well, for many people in the communities that we are most concerned about, because they are being affected out of proportion to everyone else, transportation is a big challenge. Just getting to the doctor's appointment can be a challenge. And that's something you've been prepared for. If you've got a small window to get a vaccination, and it means getting transportation or having gas money to give somebody so that they can drive if it's all drive through, and you don't have a relationship with your local public clinic, or you're not affiliated, say, with Church Health Center or something like that, then you have to first figure out where they're giving them, figure out how you get an appointment, figure out if you get an appointment, how you get there, and then get there.
Yeah.
So that's a lot of stuff to have to do. So the first thing we have to do to make it more accepting than hesitancy is to make it accessible. Get it to where the people are. And there are across the country, I'm working with a national group that is focused on engaging with communities about what do we need to do to get y'all access to the vaccine. And we're hearing things like, y'all can bring a mobile van into the community for every other thing you want. Bring that van in and bring them shots. That you can do it at a community center if you have the political will and the medical willingness. You can bring these things to people on scheduled days to let them know we're going to be in your neighborhood on, March the 12th. And everybody who's in that category, we want you there. This appointments and, setting up and navigating the internet or waiting on hold for an 800 number. For many people, that is just too much of a challenge, too much of a challenge. And I know it should be a high priority for them, but let's balance. I'm going to get the vaccine as soon as y'all can get it to me. But in the meantime, I got children to feed, a roof to keep over our head. And we've just gone through a water crisis where you got to boil water and all of that other stuff. And I got to go to work, and it has to be at a time when I can take off, or I won't be able to do it unless it's a weekend, and everybody wants to go. I mean, the list of reasons that complicate this can be as high as the mountains.
Yep.
And what we've got to do is chip away at that mountain and get it down to ground level where people can say, I can just go down to, because I don't, if you don't have a CVS or a Walgreens, you can't go to the drugstore to get it.
Right. I mean, you raise acceptance and accessibility. So it almost seems to me that you're saying, you referenced the video that we released earlier on in this crisis, that the way that we partnered across sectors, I mean, business community, faith community, the health community, the way we partnered then around combating the virus, understanding that this is going to take a communal response. It's the same way that we have to deal with this vaccine, not only acceptance, but accessibility. Does that seem to be?
You are absolutely, you said it much. See, that's why you the reverend and I'm the psychiatrist. You said it much better than me. And that's really fundamentally where, at the end of the day, what we want to have happen is more people vaccinated so that we can move to the next phase of opening up, and for however you define it, get back to some semblance of normalcy.
Yes, that's the goal, normalcy. Faith community is very important in Memphis. People often call us the buckle of the Bible Belt. And, if you would speak to me as a member of the faith community, possibly others who are viewing today, do faith leaders, pastors, rabbis, imams, do they have a responsibility to educate, or at least provide, as I said earlier, resources to provide these resources to their congregations so that they can wade through the decision-making processes as to whether or not they will take the vaccine? Do faith leaders have that role?
Well, certainly as a child of the South, I was born and raised here in Memphis, grew up right in South Memphis, 38106, 38109. So from my standpoint, my understanding of faith has always been attached to service and service in furtherance of keeping the flock whole and healthy. And so for me, I cannot imagine a faith community that does not see and play a role in this current crisis, irregardless of the faith, the denomination, or whatever. As the shepherd, if you will, of the flock, I think these are the times when we really do have to go all out. I say the same message around overall health and well-being, whether it's diabetes and hypertension and how we feed our flock on Sundays after service, or whether or not we host walking communities so that people can safely walk around the church parking lot, if that's the only place where they can safely do it. Or in inclement weather, whether we can use the church as a way to get people physically active, because we know how important physical activity is to our overall health and well-being. So anything that has to do with health and a healthy lifestyle, I consider within the purview of the faith community. And in this particular case, because it is so challenged by misinformation, I think it is our responsibility, not just as a faith community, but as a community of faith, that we this is all hands on deck, and that as much information and education as every faith leader can get or needs to get, they need to call on folks like me, like Scott, like other people who have this information, and either share it with you or bring us in front of people that need to hear it, whatever it takes during this time for us to all get on the same path around moving towards health. The things that I identified just a moment ago, if the faith community is the buckle of the Bible, if Memphis is the buckle of the Bible belt, we're also the buckle of the diabetes and stroke belt, the buckle of the cardiovascular disease belt, the buckle of certain other things. So if we're going to be all of these buckles, we need to start unbuckling some things, and it is these 3 or 4 illnesses that set Black and brown people up, if they do get the virus, to have a worse course with the virus and to die. And that has got to matter in a community of faith.
So many, persons in the African American community have died, and of complications, as we say, of COVID-19. And just as you talk about those comorbidities that we see, throughout Memphis, that are affecting us. So all the way from, heart disease, diabetes, so forth and so on. And so it would seem that, African Americans would be, and people of color, when we look at the number of people who've been infected and the number of people who have died, seems like there would be more acceptance to the vaccine, that if this is going to help provide me some coverage to keep me from having severe illness if I contract COVID-19, it seemed like we would be a whole lot more open to taking it, so that we can stop, so many people senselessly dying.
Yeah.
So, you talked about acceptance and accessibility. I would even push forward to say, isn't this a necessity, right? And not to say I'm making a decision for anybody, but, if I were to wager, I would wager on, well, the risk of not taking the virus, or taking the vaccine rather, far outweigh, the risk I take if I don't take it. It seems like, this is not only something about once it is accessible, shouldn't people of color be more open to taking it if it's going to save life?
Well, yes and no, or no and yes, depending on your perspective. And the reason for that is, if this were a linear issue, there is a virus, there is a vaccine. If you connect the dots, taking the vaccine keeps the virus away. But in between there are all of these little sidebars that as a community of color, we have to also recognize are significant, sometimes barriers, and sometimes just little speed bumps, but they can be significant barriers to the willingness to understand that linear connection that you just described. There is something that is killing people. There is something that can keep people from dying. Put them together, it's somebody at risk taking a vaccine. But we also know a few things about the community we're talking about. For example, in this community, many of the people who were designated as essential workers on the lowest rung of the economics scale, with the least amount of supports for those, what we call in medicine, social determinants of health, whether it's stable housing, food security, good education, employment opportunity, or whatever, that these are the people who are way low on that. And for many of them, they're barely making a living wage. And so if I, as the head of household, and we discovered, the city did a survey and discovered that for a certain group within the Black community, there remains, if not a hesitancy, an outright resistance to the vaccine based on the fact that they are the head of the household. They must stay in the ability to work and to take care of people. And with the uncertainty swirling around and the misinformation, they weren't comfortable that they had enough information to make a decision in their best interest. And so we have done a very poor job, in my estimation, around helping them to understand where that may not be accurate. That for middle-aged Black women who are heads of households, that's the largest group, according to the city's poll, of people who are adamantly opposed to taking the vaccine. And they have good reason, they believe, to be opposed. And until we can come up with the right match of information and fact that will dispel that to their satisfaction, they could remain high. And think about who that is. That's your church member, that's your child's school teacher, that's the nurse or the nurse's aide at the hospital, that's the cafeteria lady, the school bus driver, essential people who cannot make the linear decision that we're asking them to make because they've got all these other little things that are sidebars in their lives. You know, if I'm in a multi-generational household and I'm going out every day and risking bringing it back to my mother and her elderly sister and a great uncle who's blind and diabetic, you know, I've got to balance a lot of things. It's not just I'll get the vaccine and everything will be okay. It's if I get the vaccine and I have a bad reaction, or if I get the vaccine, but by then I've already infected them, or any number of things, you know, that can be a question in their mind. It's not a simple linear thing, but I will also say the yes part of my answer is we can do this. We can help them understand how to navigate all of those twists and turns in their lives and get them to make an informed decision. They may still decide not to take the vaccine, but it'll be based on information that they can trust.
Yeah, I think it's important. So, you know, education is certainly important before vaccination, right? Being knowledgeable of what this is so you can make a decision. But we've got to honor those, as you put it, sidebars. We can't dismiss that stuff because, you know, people bring that to the decision that they're weighing as to whether or not they get the vaccine. And I want to just, you know, tie this up with one final question. We talked about the importance of the role of faith leaders in this piece of vaccine education. I guess I would wonder, as you think about those sidebars, and do we have also not just a role in education, but a responsibility to be role models when it comes to taking the vaccine? Earlier on, it was important for us to sound the trumpet about wearing your mask, you know, physical distancing, all those kinds of things. As we get to this point, and I'm really might be asking this in an ethical sense, does it help for faith leaders to come out and say, you know, I've taken the vaccine, and, you know, this is, you know, my reaction to it, if I had a reaction? Do faith leaders have the responsibility to be role models concerning the vaccine?
Well, actually, Reverend, I think we all have a responsibility to be role models. When I did my, I got my 2 shots, and I got someone to film me both times and posted it on my social media. And I, I described the first 9 hours after my second shot. Everything was fine. I felt great. The next day or so, I really felt like I had come down with a bad case of the flu. I stayed in bed. I didn't eat, all of those things that you've heard, but that passed. And since then, I felt absolutely fine. I'm feeling much more comfortable that while I will still wear a mask, I will still use hand sanitizer and wash my hands regularly, I will still socially distant. I'm at least comfortable with what I know about the vaccine and how it works, that I'm a lot better prepared and a lot safer in a health sense as a Black woman in the midst of a pandemic who has an age and pre-existing conditions that would put me at risk.
Mhm.
So I'm feeling better about the decision that I made, and using my platform to show people, the shot itself didn't hurt. I didn't have any problem at the injection site. And were it not for that day after kind of bad flu feeling, everything has been fine since then. And psychologically, which is the only thing we have not talked about, psychologically, I am much calmer about the likelihood of contracting the virus now that I've been vaccinated, fully vaccinated. And we don't talk enough about how this has affected people psychologically. The loss of ritual, those things that tie us together, especially in the Black community, everything from the birth of a child to the homegoing celebration has been lost to us. Birthdays don't get celebrated, graduations, weddings, everything is off the table because it's dangerous and people could die.
Yeah.
And we haven't talked enough about that. And that's another place where I think the church can be particularly helpful, because that is the place we go to for comfort and solace in our time of need.
I have to ask this one last piece. The generational challenge, right? Um, and of course, in the according to the vaccine rollout plan, we're only at 65 and over. I'm anticipating and I'm concerned about people who are part of my generation and younger. Um, some might be feeling like, hey, I kept living my life during the pandemic. I took advantage of the lower airfares and hotel rates. I traveled and I didn't get COVID. Um, and now we're at the point where the vaccine will be more widely available as this year keeps going. Um, how do we communicate to millennials about the importance of becoming educated about the vaccine and the possibility of taking it?
Well, without being overly dramatic, short-term actions have long-term consequences.
Mm,
And we have to help them understand that in this particular instance, it's not just about them, that we still aren't as clear as we'd like to be on how you transmit this, and how you contract the virus but don't get sick, so you don't know that you're a carrier. And for those young people, my suggestion to them would be, think about what it would be like if your mom hasn't hit the magic number of being able to get the vaccine, and through all of your going about and running around and not taking the proper public health precautions, just as it's time for her to be vaccinated, she contracts COVID and dies. And that's a bit dramatic, but we've heard the horrible stories of people who thought it was okay to continue living as if we were not in a pandemic, to not follow public health guidelines, and the fact that families have been torn apart, both through the deaths as well as the decisions made that led to people gathering in ways that simply was not healthy during a pandemic. It flew against the face of public health guidelines. It made no sense in the context of where we are in the midst of the pandemic. And as we've heard this week, 500,000 people dead a year after we first heard the words COVID-19. That gives me pause. And I would hope that my young colleagues and friends would say, you know, I know I want to have my life back. I know I want to live a certain way, but at the very least, I need to practice good public health.
Yeah.
I am not so self-centered and focused on me, or my, that I can't recognize my role as a citizen in this community to do whatever is my part to help people. And then there are students across, college and university students around the country who are forming campaigns within their own peer group. One of them that I ran across, I can't say because this is sponsored by a faith community, but but it really is in your face, millennial to millennial kind of conversation about, you can't just say that. It's not about you. It's about all of us.
Yeah.
The fact that students aren't able to be back on college campuses in full force, this whole virtual learning and what it's done to social development and psychological well-being. I mean, there are so many things that we can put in front of our young family members and friends and colleagues to help them understand this is fine for you, but what about everybody?
Yeah. Yeah. We just had a question come in, and the question was, if I get both shots of the Pfizer Moderna vaccine, can I still get COVID?
Well, that's one of the challenges of the newness of all of this. We are anticipating that, like with other vaccines, that this will provide some immunity first and foremost, but also that if you do get COVID, that it will be less serious and less life-threatening. We believe that at least the level of immunity provided in the vaccination itself, in the vaccine itself, is enough to what we call mitigate, which is just a fancy word for reduce how it makes you feel in terms of illness. But we're hoping that we're going to get enough of that immunity. That's why that early data around 90-95% effective is so optimistic for most of us, that if we can achieve that, even if you get COVID, you may not know you got it
Yeah.
because it won't make you sick.
Wow. Wow. We've got a number of questions that are coming in now, and our time is drawing near. I want to just, I don't know if Joshua wants to jump in and just pose these to us. Um,
Yes, I'd love to. And guys, as you continue to have your questions, throw them in the Q&A so we can keep track of all of them. Sometimes it's hard to do so in the chat with the way things move. But one question, and we know that a lot has changed in terms of vaccine distribution over this past week. Can you speak to, and Dr. Morris, you can jump in here if you'd like, where we can get accurate information about vaccine distribution in the city of Memphis and Shelby County?
So yeah, I'll be happy to jump in. So first off, the simplest thing to do is go to the website COVID-19 memphistennessee.gov. COVID-19 memphistennessee.gov. That lists all the options, and from that website you can go sign up for your first appointment. Now, all the conversation that's been going on, just forget all that. There are multiple sites now where you can get vaccinated, and some of them are definitely in church-related areas. So there are a couple of pop-up sites this weekend, but the Appling site out on Appling Road is a big site. We all know about the Pipkin building in Whitehaven at Southwest Community College, Greater Amani in Raleigh, Germantown Baptist, Anointed Temple of Praise, and Cane Creek Missionary Baptist. Those are all places where you could get a vaccination this weekend. So just go to that website, again, COVID-19 memphistennessee.gov, and you should be able to find an appointment for yourself. And now you have to still meet the criteria, which is, at this point, if you're 65 and up, if you're a school teacher, and certainly the other people we've been vaccinating all along, whether you're elderly or the like. But the option, this idea of going and having to wait 3 hours at a time, that is not happening anymore. You know, forget a month ago. We are now in a whole new way of doing this. You don't have to wait forever. You don't have to be worried about getting turned away. Those issues are behind us.
Is there anything that you would like to add, Pastor Turner, Dr. Stewart, to that answer? Great. Another question that we had is around church reopenings. I guess I'll start with you on that, Pastor Turner. What does the vaccine mean for church reopenings, and what will that look like?
Yeah, so I will say this. I think every pastor, every faith leader should have an internal group of hopefully medical professionals and persons who serve in the church. I have a group, we meet weekly to talk about how the vaccine is progressing, and also to talk about what reopening, whenever that happens, will look like, and develop a plan for your initial, I call it initial public offering. What will reopening look like day one for your church? The health department is available for technical assistance. So they are open for you to submit that plan to them, for them to review it, provide their input, and even they will come and do a walkthrough with you to help you understand what needs to be in place as you begin to reopen. I will say this, it's going to look drastically different than when we were the last Sunday we were all together, and we've got to get our minds around that and be okay with it. But it means a whole lot more cleaning. I think it will initially mean masking during worship. You might not have a full choir, but whatever that plan is, I think it's important that you write it down, you think it through, you submit it to our health department, and let them walk through it with you.
Can I just add, the more people who get vaccinated, the quicker church is going to look like church.
Mm-hmm. Yeah.
Amen.
Amen to that as well. We have a few more questions. We'll try to get to them before our time is up. Could you guys speak, especially you, Dr. Stewart, to the Johnson & Johnson vaccine that we were hearing a bit about, around how it's manufactured and how it works compared to the mRNA vaccines that we currently are using?
Well, I think the big difference that people are aware of is the single dose, that instead of having to do 2 shots, you can do 1 shot, which is really important only from my standpoint, really important only in the fact that now we have 3 vaccines out there. And my position, like many in the public health community, is whenever you're up for a vaccine, and whichever vaccine is available, there is comparability of effectiveness in terms of how they protect you across all 3. And I wouldn't say, well, I'm going to wait until I have access to the 1-shot vaccine. I would get vaccinated, because Dr. Morris is absolutely right. The more we can get people vaccinated, the more we can start to getting back to normal. And for me, the bottom line is people are getting fatigued, and they're starting to make not so healthy decisions. I won't judge whether they're good or bad. They simply aren't healthy decisions. And the more we can convince people that vaccination is the way to get to the light at the end of this tunnel, the better off we will all be.
Joshua, can I just jump in on the J&J vaccine? So hopefully Dr. Stewart alleviated anybody's worries and fears about the newness of the mRNA vaccine. It is new science. In my opinion, it's like amazing science, and it is a better path. The J&J vaccine is a traditional vaccine.
Yep.
It is no different than getting a flu vaccine in terms of how it works. So if anybody has lingering concerns about the RNA vaccine, then the J&J vaccine should fine. Just go. It's just like you're going to go get a flu shot.
Mm-hmm. Mm-hmm. Good point. Yeah.
Thank you for that information. And there is one final question I want to squeeze in around, because we know there's a complex landscape around decision-making for vaccine distribution. And if you guys could speak for a moment to who manages and decides how vaccines will be distributed. And that'll be a question.
Yeah. Currently, just because I've been a part of some of those conversations. Currently, first, of course, the federal government distributes to the states. And as of this week, we know now the state is directly working with the city of Memphis and local hospitals and health clinics around the distribution of the vaccine. And so, of course, there's a federal decision about how much Tennessee gets. Then there's a decision at the state level as to how much Shelby County gets. And then that is, the decision is made now at the city level in working to get it to various sites to get it into people's arms. So I'm sure Dr. Stewart, Dr. Morris might have more to add on who makes the decision.
So if anybody hadn't figured out that politics has a lot to do with all of this by now, I mean, what can I say? Who gets what is mostly determined by the state right now. So for better or worse, people in Nashville don't necessarily love Memphis, but that it's created a lot of problems for us. But look, we got enough vaccine right now to go vaccinate people. So let's quit worrying about how much and whatever. Let's go vaccinate everybody we love.
Thank you all for this robust discussion, and for those questions that we weren't able to answer, we'll try to address them in our electronic communication following this webinar. As always, there will be follow-up for all attendees. A recording link, a recording of this webinar will be provided, as well as the slides that Dr. Stewart shared during her presentation. And we'll make sure that you get all the information that was covered during our time together. I'll ask Pastor Turner to close us in prayer as we end our time together.
Let's pray. God of grace and glory, we magnify and glorify your name. We thank you for the witness and work of Church Health and for medical professionals across this nation and this world who continue to be on the front lines of this pandemic. We thank you for those who have worked in the public health space to keep us informed. And I pray that you would grant not only leaders, but all who make up our community wisdom and courage to face the challenge that is before us. And we ask you, oh God, to send healing unto our land. Now, God, as we go throughout the rest of this day and into the weekend, we pray that you would hold us with a grace that will not let us down and will not let us go. In the name of the one God who gives us the audacity to hope. Amen.
Amen.
Thank you, guys. It was a great webinar.
Thank you. Thanks, everybody.
Take care. Have a good one.
All right, everybody. Take care.
Bye, y'all. Thank you. Take care, Altha.
All right. Take care, Scott.